And I think you also have the psychological issues. People find themselves avoiding certain settings, maybe certain social events, certain kinds of recreational opportunities. It can make you feel unhappy. It can augment the depression just by feeling that sort of self-consciousness.
Interesting, but I would like to dispel one myth about that. Not all overweight and obese patients are psychologically impaired. They are not depressed. In fact, some of these people are amongst the most accomplished people that we have in our society. I think they may be compensating to some extent with their work, with dedication to the work. So, and you know, now that I'm kind of a weight loss expert, I must admit that I used to think that everyone who walked around overweight and obese must be depressed. They're not. So that's a myth. Many are, but basically there are many people who are overweight and are not at all depressed. And not all psychologically impaired. But that's a bias and a prejudice that they have to endure. So when they go for job interviews or are interviewed for graduate school, you know, someone's thinking, well, would this obese patient be a good doctor? I mean, he or she is probably impaired. I don't think we should have this person in the medical community. But so that's, I think where they may not be depressed, they're often prejudiced against because people think they're depressed.